Yes, this name is familiar to most of you who deal with pancreas. He discovered the He discovered the main pancreatic duct while he performed an anatomical dissection of an executed criminal. And he never published it, but he engraved it on a copper plate, as you see here. He described 21 branches of the pancreatic duct. He also described its connection or relationship to the liver and the bile duct. But as I said, it is morbid to work on pancreas, so the next year he was murdered by his own student because there was some argument as to who actually discovered the pancreatic duct. So even now, unfortunately, we have been reading in the newspaper that a student murdered his teacher. So this is not a new thing. It has been there from the 15 or 1600s. Another point is that we went from 100 AD to 1642. I mean, 1,500 years, there was nothing written on the pancreas. This was because that was the dark ages when the religious people said you should not desecrate the body. So there was no cutting up of the body, there was no studies, and that's why this long gap between AD 100 and 1642. The next name is Giovanni Santorini. Again, I think you will remember this name. Santorini was an Italian anatomist. You can see his picture there, a reasonably handsome young man. And he discovered the accessory pancreatic duct. Abraham Vater, name is familiar, a German anatomist who discovered the duodenal ampulla, which he called a tubercle of the duodenum. Rogero Odai is again familiar, the sphincter of Odai. You see this gentleman there. He was a very brilliant guy who discovered the choledochal sphincter as a fourth-year medical student. But his professional career was cut short because he was dismissed because of drug addiction and manslaughter. Again, he joined the French Foreign Legion and he died fighting. So now we go on to the pancreatic physiology. Franciscus Sylvius of Amsterdam is very important because he, for the first time, showed that digestion was a multi-step process involving the mouth, the stomach, and the pancreas. Earlier, it was thought only the stomach and the mouth were involved in digestion, but he was the first person who said the pancreas was also important. His student, Regnier de Graaf, is famous because he is the first one who created a pancreatic fistula, collected pancreatic juice, and this model was later used by others for studies. But this name may be familiar, Graafian follicle. He is the first guy who described the Graafian follicle. Willy Kuhne of Germany, he is also important, and what he found is that the pancreatic juice ferments food, which means there's some sort of digestion going on. And he's the one who described trypsin and its role in digestion of protein. And he's the first guy who introduced the word enzyme into the world. Alexander Marset identified lipase in 1815, and Claude Bernard of Paris. Claude Bernard is a famous guy. He was called the Parisian Prince of Physiology. You see him here actually taking a class in France. And he's called the father of experimental biology. There are many things to his credit. In addition to demonstrating that pancreatic juice digested fatty food and carbohydrates, he is the one who discovered pepsin, and he's the one who discovered neural regulation of gastric secretion. It is said that he was, again, I told you, when you work with pancreas, there are morbidity involved. His wife and his daughter deserted him. And some believe that it is because of dedication to work, but the actual story is they couldn't tolerate these animals with fistulas and tubes walking around the house. Ivan Pavlov, I think name is very common. He was a Russian physiologist from Petersburg, son of a priest. And as you will know, he discovered neural regulation of pancreatic secretion in vaguely denervated fistula and canine models, and he was awarded the Nobel Prize in 1904. Baylis and Starling of University College London. Anybody for that? He's the one. This is Baylis and Starling. They discovered the hormone, that in addition to neural regulation, there was a hormonal regulation of pancreatic secretion. They called the hormone secretin. And for the first time, this word hormone was introduced into the world. And they actually started a new branch of medicine, and they are called the fathers of endocrinology. Clinical, we go on to acute pancreatitis now. Go on to the clinical presentation. It was Nicholas Tulp, a Dutch anatomist, who gave the first clinical description of acute pancreatitis. He described a young man who succumbed to fever and much distress, autopsy showing a swollen pancreas with pus, probably a pancreatic abscess. As you would see in this painting here, he is immortalized in Rembrandt's painting, Lessons in Anatomy, and here you see Tulp teaching a group of people. He was the chief editor of the Amsterdam Pharmacopoeia, and he was very popular in Amsterdam and elected Burgomaster of Amsterdam 4 times. So Tulp was an anatomist, a physician, a pharmacologist, and an administrator. This, I think, is well known. Cullen is famous for the Cullen sign, a periumbilical discoloration, which he actually described in a patient with ectopic pregnancy, later recognized as a sign of severe pancreatitis. Gray Turner of London discovered the Gray Turner sign, discoloration of the flanks associated with hemorrhagic pancreatitis. But I think when you talk about clinical presentation, the person who is to be most remembered is Reginald Fitz. Actually, he was from Boston or Harvard. He did his medical school in Harvard. Then, as you would have realized in the anatomy and physiology, most of the work on the pancreas was done in Europe. So he went to Europe and he worked with anatomists, physiologists, physicians, and he came back to Harvard Medical School, and he has given us the first systematic analysis of acute pancreatitis in a landmark paper in the Boston Medical and Surgical Journal in 1889. And even now, it is one of the best written papers on clinical features of acute pancreatitis. He gave a detailed clinical characteristics of 53 patients, and these 53 patients were documented on pathology to have acute pancreatitis. Even at that time, he commented on the etiologies, gallstone, alcohol, trauma, etc. He commented on complications, abscess, splenic vein, thrombosis, pseudocyst. He's the first person who said that there was a relationship between pancreatitis and disseminated fat necrosis called the Fitz syndrome, and he laid the foundation for antemortem diagnosis of pancreatitis. He is the first one who described acute appendicitis. There are many other clinical descriptions that he has given, but we go on to etiopathogenesis. It was Hans Chiari in 1896 who actually first said why people develop pancreatitis. He said the pancreas succumbs to its own digestive properties. The triptych autodigestion activated by bile and enterokinase, and that explanation still holds good today. Gerhard Ketch, he said that pancreatitis is not only a local disease but a systemic disease as well, and he's the one who said that circulating activated enzymes can result in damage to other organs like lung, kidney, and pancreas. Lord Berkeley Moynihan, a surgeon from UK, stressed on the role of superimposed infection and the morbidity and mortality in pancreatitis. Eugene Lindsay OP Johns Hopkins, anybody for him?